Good afternoon and welcome. I am Tasha Green Cruzat, Executive Director for Voices for Illinois Children, powered by the YWCA Metropolitan Chicago. We are pleased to present to you data and findings from our 2020 Kids Count on Health Inequities. Joining me today is Mitch Lipson, Vice President of Policy for Voices for Illinois Children, and Dr. Bill Burns, who is our Kids Count Project Manager. Next slide. Before we get started digging into the data, I just want to give you a little bit of an overview of Voices for Illinois Children. We've been around for more than 33 years doing child advocacy for children here in the state of Illinois. Our work includes our Kids Count, our fiscal policy analysis, policy, policy advocacy, and early childhood education. Next slide. We operate off of 4 pillars with using a race, equity, and inclusion lens: education, health, family and community, economic well-being. And we do this all in advocacy so that our kids can have a better future, they can be safe, they can be healthy, and we can continue to do the work that we need to do for our children. So next slide. As part of our work, we do have our Kids Count Data Center and our Kids Count project, which is managed by Dr. Bill Burns. This project has been funded by the Annie E. Casey Foundation to track the status of children and families in the United States. Guided by the data, we seek to strengthen public action and investments to secure a brighter future for all of our children. So when we think about policies and practices that are best for our kids, we use data disaggregated by race when available to do our work. Next slide. So our Illinois children, I'm going to go ahead and let Bill take over here so that he can provide an overview of our kids here in Illinois and some of the health inequities they are facing. Bill?
Thanks so much, Tasha. I really appreciate it. And thanks to everybody who is joining us here today for this presentation. What I'm going to be doing today is I'm going to be going through findings from both the Illinois Kids Count report as well as the National Kids Count report that was released by the Annie E. Casey Foundation about 2 or 3 weeks ago. To start off, really quick, I just wanted to kind of give an overview of Illinois children. Who are they? Where are they? What are their challenges? And how can we address those challenges? Before I get started, I just wanted to make a brief note about a lot of the data we're going to be looking at today. In virtually every single indicator that we look at where data are disaggregated by race and ethnicity, we see that there are significant racial and ethnic disparities. The position that we take at Voices is that racial and ethnic disparities persist because racism persists, and it's not because there are physical, genetic, or cultural differences among races and ethnic groups. So just keep that in mind as we're going through the data we're going to be checking out today. A lot of the indicators we're going to be talking about today are taking place in this context of change in the state of Illinois. We can see here that from in between these 2 5-year periods from 2009 to 2013 and 2014 to 2018, there have been some statistically significant changes in the racial and ethnic makeup of kids in the state of Illinois. The changes don't look particularly large here when we look at the rates here by race and ethnicity, but when we look at the raw numbers, we can see that there's some pretty significant population shifts occurring in the state. So for example, between these 2 5-year periods, there was a decrease of almost 50,000 Black children in the state and a decrease of almost 125,000 white children who are not Latinx in the state, while there have at the same time been some significant increases in Asian children and children who identify as multiracial as well. And in fact, in between those 2 time periods, Illinois' child population decreased by almost 159,000 kids. Most Illinois counties in these 2 time periods saw statistically significant decreases in their child populations, and only 4 counties in the state saw increases in their child populations, and 11 counties saw no change. So there's some changes going on here in the makeup of the state by age, as well as by race and ethnicity. And we have to consider that in the context of all the indicators I'm going to be talking about today. Now, first, I'm going to be going through the findings of the 2020 Kids Count data book released by the Annie E. Casey Foundation. And we're going to be talking about how social indicators have changed over time and what disparities exist by race and ethnicity. Just a little background, the Annie E. Casey Foundation releases a data book every year, and they provide data on 4 broad categories: economic well-being, education, health, and family and community. And what they do is they rank all 50 states by their their position along these 4 indicators, but also they do an overall ranking. And Illinois basically found itself in the middle of the pack this year. We ranked 24th in the nation. And it should be, we have to remember that you know, these changes and these rankings that they give us might only be the difference of a few tenths of a percentage from one year to another. And an improvement in a rank does not necessarily mean that the problems that Illinois faces, for example, like child poverty, has necessarily been solved. So we just have to keep that in mind as we look at these indicators I'm going to be presenting to you. The good news is that we've seen improvement in a variety of indicators since 2010. So the percentage of all children in poverty for all groups by race and ethnicity declined from 2010 to 2018. However, in 2018, the poverty rate for children was still 16%, which amounts to about 457,000 kids. For children of color, however, the percentages were much higher than in other groups. So for Black, Latinx, and multiracial children, their poverty rates were 35, 20, and 18% respectively. For children living in concentrated poverty, though, that tells a bit of a different story. Now, concentrated poverty, the Annie E. Casey Foundation defines an area of concentrated poverty as a census tract where the poverty rate there is 30% or more. And in that 5-year period of 2014 to 2018, 34% of Black children in the state lived in areas of concentrated poverty. And we can see from this chart here that that rate outpaces every other group in the state. And just to provide some contrast here, only 2% of white non-Latinx children live in concentrated poverty here. So we see that there's still some pretty significant issues in terms of racial disparities and class disparities as well. And just to give you a sense of where areas of concentrated poverty are in Cook County and the collar counties, we've got the collar counties on the left-hand side here. The areas that are highlighted red are census tracts where the poverty rate is 30% or more. And the same is on the right there for Cook County. And we can kind of see, we can get a sense geographically of how poverty is distributed geographically in the Chicago metropolitan area. Now, one of the things that might be contributing to this, these significant disparities in poverty rates are the percentage of children living in families where no parent has full-time year-round employment. 47% of Black children in Illinois in 2018 lived in a household where no parent had full-time year-round employment. That's more than twice the percentage of white children in Illinois at a rate of 18%. And we can see here that unemployment affects groups quite differently, particularly across time. So we see the significant increases in unemployment when we entered the economic recession about 10 years ago. And we can see that the recovery from the recession has been felt rather unevenly depending on what racial or ethnic group people are in. And you know, in addition to that, we also see some pretty significant disparities in terms of median household income. So in that time period of 2013 to 2017, median household income was the lowest among Black Illinoisans at about $35,000 to $36,000. And we can see some pretty significant disparities. So American Indian or Alaskan Natives, Black Illinoisans, people who identified as multiracial, people identified as other by the Census Bureau, and Latinos of all races found themselves with household incomes below that of the state median household income. Now, I'm going to be reviewing some of the health inequalities that we discovered in our state report. But I'm also going to be reviewing, after looking at some of the health data, some of the social determinants of health that we argued are tied up with a lot of the health inequalities that we're going to be seeing here today. Mitch, why don't you take it away in terms of the percentage of uninsured children in the state?
Sure. Thank you very much, and good afternoon, everyone. And I also want to reiterate as I start that the information you're seeing from the two reports is pre-COVID data. So we recognize that with respect to household income, employment, even health insurance, these numbers are going to change over the next few months, but we just do not have that data currently available. So what this slide reflects here is that in the past decade, there's been progress in providing health insurance to children. A significant reason for this has been the expansion of care under Medicaid and the Children's Health Insurance Program. Medicaid for Children, CHIP, and a pool of state dollars are all part of the state's All Kids Health Insurance Program, which is run by the Illinois Department of Healthcare and Family Services. But a disturbing trend began to emerge in 2017 with fewer children having health insurance. There are potentially several reasons for this. On the federal level, there was repeal of the individual mandate penalty for not having health insurance at the end of 2017. Also, at that time, there was delayed extension of the Children's Health Insurance Program. There were fewer available resources for Affordable Care Act outreach and enrollment efforts. And there were debates about immigration and public charge, and that may have chilled access to healthcare services for some. It should also be noted that in 2017, Illinois experienced problems with approval of Medicaid applications, including redeterminations, as it began to use a new computer system. But you can see over on the right-hand side the data for children under age 19 without health insurance. And you can see that for the Latinx population and the African American population, they are higher than the white population. Next slide, please. So where do those who have health insurance secure it from? Well, nearly 40% of individuals secure that health insurance through Medicaid or some other means-tested public coverage. And we wanted to point that out because we think it's important to recognize that fact and the significant role that it plays, and therefore the importance of making sure that we get that right. Now, with regards to delivery of healthcare under that system, several years ago, the state began to move more of its Medicaid population into managed care. And as of last year, 79% of children enrolled in the All Kids program were in managed care organizations that were delivering the health care. Those managed care organizations regularly send out surveys to those who they're providing medical care to. And then there is a ranking that is done from that collected data to national norms. And Bill, if you go to the next slide, what you see is that when it comes to children who are under Medicaid getting needed medical care or children getting care quickly, we're at the lowest possible performance ranking compared to a national standard. So there apparently within that data is an indication that of all the managed care organizations, there is work to be done when it comes to delivery of healthcare, because it's not just the provision of healthcare in terms of having the insurance, but being able to access the care. Bill, I'll hand it back to you.
Thanks, Mitch. So related to this issue of access to care, what we found kind of surprisingly when we were starting to look at data in the distribution of pediatricians throughout the state, we found that 47 of Illinois' 102 counties did not have a practicing pediatrician. Most of those counties are mostly rural. And although this doesn't mean that children in those areas don't see doctors, what it does mean is that children are not seeing doctors who specialize in children's medical care. And in light of what COVID-19 is doing to the state of Illinois and the nation and the world as a whole, it's important to have as much access to healthcare as possible. We can see here kind of a breakdown by zip code across the state of the rate of COVID cases per 10,000 of the population. And what you can see here, we can see that there are a variety of areas that are much harder hit, mostly in the northeast portion of the state. And you can see here that the areas that are colored in red, those are, and the areas that are colored in yellow and orange, for that matter, are areas that are mostly populated by people of color. One of the exceptions is Niles, which is majority white, but has one of the higher ratings of COVID-19 infection in the state. And in addition to specialty care like pediatricians or care associated with COVID-19, we also see some disparities in other areas of healthcare as well. So for example, oral health, when parents rate their children's oral health, Black children tend to have their teeth, the condition of their teeth rather, rated fair or poor more frequently than children in other groups. And Black and Latinx and children who identify as other have higher rates of oral health problems such as toothaches, bleeding gums, decaying teeth, or cavities in the past 12 months. Those are all groups that are higher than the overall state rate. And one of the reasons this is concerning is because poor oral health can contribute to other health problems such as heart disease, respiratory infections, or it can actually even exacerbate the conditions associated with diabetes. In addition to that, Black children in the state also have blood lead levels that are generally twice as high as any other racial or ethnic group in the state. It should be emphasized here that there is no safe level of lead to have in your blood, and Black children have elevated rates of lead in their blood at a rate of 3.1%. Every other group hovers around that 1.5% average there. In addition to which, we also found some concerning data showing the rate of pediatric emergency department asthma visits that are taking place throughout the state of Illinois, and we can see that Black children far outpace the next group down, which is Latinx children. There's almost there's over 4 times the rate for Black children that is for Latinx children in the state. And we can see a map on the right here by county of the rate of asthma emergency room visits. Now, to just kind of put this into perspective, we have 3 other maps here showing, I put all 3 maps on the same scale. And we see on the left-hand side, that's the map for white children. In the middle is the map for Latinx children. And on the right-hand side, there's the map for Black children. And we can see that Black children throughout the state, depending on geography, are having to go to the emergency room for pediatric asthma emergencies far more than any other racial or ethnic group, and far more, just in terms of geography as well. Now, one of the most concerning sets of data that we analyzed comes in the form of data on infant mortality. And the Black infant mortality gap has existed since data collection started in the 1920s. And it's not entirely understood as to why this gap persists. But the main point is that Black infant mortality is consistently twice that of the state rate. And no other racial or ethnic group exceeds or meets the state rate of infant mortality. And a few of the reasons this might be occurring is that Black women have historically had higher rates of low birth weight children and less frequent medical attention early on in pregnancy. And in fact, epidemiologists are starting to consider the possibility that the chronic effects of anti-Black racism are one of the major factors contributing to this, this very significant gap that we see in Black infant mortality and the state infant mortality rate, as well as the gap between other racial or ethnic groups as well. Now, one of the main arguments that we make in the report is that the reason we see disparities in children's health outcomes by race and ethnicity is because there are disparities by race and ethnicity in the social determinants of health. Now, basically that's a way of saying that our social environments condition and affect our health environments. So doctors and researchers and epidemiologists have known for a very long time that social inequalities are major contributors to health inequalities. So for example, the area that you live in, the kind of water that you drink, the air that you breathe, whether or not you live next to an industrial area, how close you live to a grocery store, the age of the buildings in which you live, and how much money your household brings in. All of these factors might actually have more of an effect on group health outcomes than anybody's own personal decisions about how they manage their health. So, for example, we see that 11% of Illinoisans face food insecurity, and 15.7% of kids in the state face food insecurity. But that food insecurity is unevenly distributed by geography throughout the state. So we can see here that different counties are affected far more by food insecurity than others. The age of housing that a person lives in can also have an effect on one's health. Illinois has the 7th highest rate of housing built before 1980 in the nation. And one of the main concerns with the age of housing is that in older housing, children can be more exposed to environmental health hazards such as black mold, or related to the data on blood lead levels that we saw earlier, there's a potential problem with their lead ingestion if they live in older housing. So if you've had a baby anytime recently in the state of Illinois and you've seen a pediatrician, chances are your pediatrician has suggested that your child should get their blood tested for lead if you live in a house that's older than that is older than that built in 1980. And we can see that older housing is unevenly distributed, not only across the entire state, but also within Cook County and the city of Chicago as well. In addition to that, people have differing means of transportation in their communities and their means to get to work. Black Illinoisans utilize public transportation far more frequently than any other racial or ethnic group. And this puts people of color, particularly Black Illinoisans, at higher public risk of contracting COVID-19. In addition to which, there are also racial and ethnic disparities in who works in the service industry. Workers of color more frequently work in the service industry, and again, this potentially puts them at risk of more infection from COVID-19, especially in the context of the fact that the state is starting to somewhat open back up. In addition to this, parents rate their neighborhood safety for their children differently depending on their race and ethnicity. We can see that Latinx parents somewhat or definitely disagree with the idea that their neighborhood is safe more frequently than other groups. And Black parents only somewhat agree that their neighborhoods are safe more frequently than other groups. And as you can see, for those who definitely agree, Black and Latinx parents are the least likely to definitely agree that their kids live in safe neighborhoods. In addition to this, we also see some pretty significant disparities in terms of math and reading proficiency in the state of Illinois. So on the left-hand side, we see fourth graders who scored below proficient in reading. And, although, Illinois' numbers across all racial or ethnic groups are still fairly low, they're, Black children and Latinx children, as well as multiracial children, tend to face issues with math and reading proficiency far more than other groups. And we believe that part of the reason for this is because Black and Latinx children tend to live in very segregated areas, and there's a lower tax base because those areas that are segregated by race and ethnicity are also segregated by class. And so these are communities that have far fewer resources, particularly in their schools, that children are able to draw upon when they need to get better at math and reading. Now, Mitch, I'll hand it off to you for our recommendations.
Thank you. So there are 6 recommendations contained in this report. And the first recommendation has to do with data collection. So stepping back to the All Kids program again, unfortunately, when it comes to enrollment data for that program, and when it comes to securing the information of enrollees by race and ethnicity, we don't have the full picture. And that's because listing one's race or ethnicity when enrolling in the program is not required as part of the application process to determine whether or not a child is eligible. So with the data on hand and looking at it currently, as it's listed by the race of enrollees, 50% of the children are designated as unknown. So we think it's very important to disaggregate the data and to look at the service delivery and to look at the demographics of the area being served so we can see if in fact there is a match or if something is out of sync. Currently, the Illinois Department of Public Health, the Illinois Department of Human Services is under a mandate by state law to collect and publicly report statistics on the race and ethnicity of program participants for each program administers. And we would recommend extending that law to other agencies, such as the Department of Public Health and Healthcare and Family Services. Our second recommendation has to do with making additional investments in school-based health centers. Both urban and rural areas need these centers. It has been found through studies that they do improve student educational achievement and attainment. Going back to the All Kids program and the survey data that we showed you earlier about how patients feel about the service being received by children under Medicaid, it's clear that there is dissatisfaction, and we think that the Department of Healthcare and Family Services needs to dig into those particular line items. And in doing so, determine whether the issue has to do with lack of access because maybe the reimbursement rate for particular services to medical providers is too low. Maybe there aren't enough in-network providers, or maybe there are issues related to transportation that could be addressed. Our next recommendation is to increase community-based mental health services. Beginning in 2009, the Illinois Children's Healthcare Foundation embarked on an effort to establish community-based mental health systems in 4 areas of the state, and they saw a significant increase in the number of children screened for developmental and health concerns. So we believe this model has some genuine benefits and can help in identifying those needs early on. Addressing racial and ethnic disparities in infant mortality. Phil covered the disparities in the infant mortality chart, and the data shows that compared to the national ratio for African-American infant deaths to white deaths, Illinois' ratio was higher than the national average in all but 1 year from 2009 to 2019. There's currently a state law which created a task force on infant and maternal mortality among African Americans. It has been meeting. The task force is to report its findings and recommendations to the General Assembly by the end of the year. And then our last recommendation in part depends on what happens in Congress over the next few weeks and months. As this report indicates, poverty can have a significant impact in the life of a child. The economic downturn caused by the coronavirus pandemic has only made things worse for many Illinois households. And depending on what future action Congress does or does not take, the state may well need to look at further measures to improve the economic well-being of Illinois residents. That could come in the form of increasing benefits under the SNAP program, or providing more housing assistance, assistance with utility bills, or some other type of income support. Next slide, please. So I would be remiss if I did not reiterate the impact the census and its results can have on children's health. Medicaid uses census data in its formula for calculating federal reimbursement levels. CHIP uses income data from the Census Bureau to help determine eligibility and the allocation of funds. Hospitals use the data for developing community assessments filed with the federal government, and WIC uses the data to help determine eligibility levels. And that's just a short list. There is a large swath of federal programs using the data for allocation of funds that are related to the school breakfast program, maternal, infant care, early childhood home visiting, low-income energy assistance, and child care, just to name a few. If Illinois ends up with a significant undercount of its population with the census, it will impact available funding for healthcare for years to come. Bill?
Thanks, Mitch. So if you're interested in getting more information or more data about some of the things we talked about today, you can visit the Kids Count Data Center at datacenter.kidscount.org. If you really like the sound of my voice and you want to watch an instructional video of how to utilize the data center, you can visit the YouTube link included here, which we can provide to everybody after the fact. And the data center has just about 400 indicators in areas of demographics, economic well-being, education, family and community, health, and safety and risky behaviors. And certainly if you have any questions about the data that we presented today or any of the other work that we do, you can certainly get in touch with us at our email addresses, or you can call me directly using that number I put there. So I want to thank everybody for joining us today. And Mitch, if I recall correctly, are we going to be fielding some questions if anybody has any questions for us?
Yes, so we have about 20 minutes, and if people have questions, they can type those questions into the chat box, and we will do our best to answer them. So I will wait a few moments to see if anybody does have any questions, and we'll go from there. At the moment, we do not have any questions, so I am going to thank everybody for joining us. Tasha, I don't know if you want to make some closing remarks about Voices and the Kids Count program.
Yes, thank you everybody for joining this webinar today. We are more than happy to continue to answer your questions. If you would like a special presentation done for a group, please feel free to reach out. We are more than happy to facilitate that. Our information is here on the PowerPoint slide. So we'll leave it up for a couple of minutes and we will continue to hang out for just a couple more minutes in the event that you have questions. There is so much information that we have here. And so I know it's a lot to swallow and a lot to take in right now. And so we want to give you an opportunity to be able to get your questions answered. Okay, I believe we have no questions at this time. Please feel free to take a picture, take a snapshot, a screenshot of our emails there and reach out to us.
You know what, Tasha? I'm sorry to interrupt. There is actually two questions here. One from Lauren Simmons here.
Great.
And Lauren asks, 47% of Black households do not have a working adult, and 40% of families' health insurance is connected to their employer. What recommendations can you suggest for this issue? Mitch, did you want to field that one, or would you like me to?
So I will take that. I think that has to do with economic supports, job training, greater investment in employment opportunities in communities, particularly underserved communities across the state. Again, at the moment, there is the Medicaid program for adults and the All Kids program for children. The federal government, as part of the CARES package, did increase the amount of matching funds that it provides to states for the Medicaid program. It's unclear if that's going to continue in the next relief package. So the short answer is that I believe on the state level, we need to work to encourage more job training as the numbers come out from the fallout from the coronavirus, that there may be other types of public-private partnerships that we can work on to generate jobs in the short and long term in many of these communities. And then I would encourage people to lobby members of Congress to provide additional relief to the states, because one of the measures that the states are looking for is funding to make up for loss of revenue due to the coronavirus. The money that was approved in the CARES package during the first several rounds of stimulus funding for states had it limited specifically to services brought on as a result of the coronavirus pandemic. States are looking for more flexibility in the use of funds to make up for revenue loss. The state of Illinois did pass a budget that is predicated on borrowing or receiving from the federal government some $5 billion, the borrowing to be repaid with federal funds. And I mention all of this because those funds will be key to helping establish the type of programs and services that we're talking about. So it's a two-pronged approach, asking for assistance in the provision of the employment programs. And also I would add again about the housing assistance and utility bill assistance on the state level, but urging Congress to pass some measure that will increase the funding for the states.
Thanks, Mitch. And the other question is, will the PowerPoint be distributed? The short answer is yes. We will be distributing the PowerPoint. We will be putting it on the Voices website, and we will also be making a recording of the presentation available on the website as well. Tash, I'll send it back to you because those are the only two questions we had.
I want to thank all of you for joining us today. Again, our information is on the screen. Please feel free to reach out. Have a wonderful day.